voilà, on arrive là pour notre conversation aujourd'hui bon matin pour ça mercredi le 28 août. Mesdames et messieurs, par émotion pour mes autres plus bonheur. Nous pouvons faire une conversation aujourd'hui avec Amsa clinique qui est facilitateur et service provider par nous dit qui donne un soutien médical nous bonnes patients et spécialisé dans dialyse. Mais aujourd'hui bon matin, on a deux autres représentants qui pouvaient faire une conversation long un petit peu lifestyle. Ici Cécile, Simon, nous connaissons nous comment est pip, nous façon vivre, nous façon faire, mais aussi avec les temps, nous sommes un petit peu influencés par différents cultures, différentes méthodes de la vie qui fait que parfois il impacte nos situations médicales. Alors, est-ce qu'il y a un des monde qui peut-être nous devrait faire un petit peu plus conscient, quelque chose que vous mangez, que vous boivez et qui est capable en l'impact sur la santé. Aujourd'hui, bon matin, nous faisons une conversation avec nos deux représentants. Premièrement, moi, nous pouvons faire une conversation en anglais pour permettre nos bons participants pour capables de communiquer. Aujourd'hui, bon matin, we've got Dr. Iyad. Dr. Iyad, good morning, and you are the medical director for Amsa?
Good morning, yes.
Good morning. It is an absolute pleasure to meet you this morning, Doctor. And of course, we also have the CFO of Amsa Group, and that is, of course, Mr. Kuldep. How are you, Mr. Kuldep?
I'm good. Good morning.
Mr. Kuldep, good morning. Yes, and of course, before we go into the conversation, we are a little bit nosy here on the morning show. So, Dr. Iyad, how do you start your morning? Tea, coffee, water?
Coffee.
And what time do you start your morning?
Start with water and coffee.
Water and coffee?
Yes.
Black coffee?
Black coffee.
Black coffee, Doctor. What time do you start your morning?
5 o'clock.
5 o'clock in the morning?
Yes.
All right. So you live, whereabouts in the Seychelles? Whereabouts on Mahi do you live? In the north, south?
I think north.
You think the north?
Yes.
Okay. And Mr. Kuldip, you've been here for quite a while now.
Yeah, well, last 5 years I'm coming to Seychelles. This is one of my second home now.
Yes, you've been in and out of the country.
Yep.
So how do you start your morning? When you're in Seychelles,
Yep.
how do you start your morning? Tea, coffee, water?
With the morning I get up and I start my day with the lime water.
Lime water?
Lukewarm lime water.
Yeah.
It will cleanse my system.
Yes.
Then green tea.
Yes.
And thereafter breakfast.
And then breakfast.
Yeah.
What time do you wake up, Mr. Kuldip?
Morning 5 a.m.
I would have thought in the Seychelles you wake up a little bit later. All right, so Dr. Iyad, this morning we're going to have a conversation about the situation in Seychelles, the lifestyle of Seychelles and how it's impacted. Of course, you working at the clinic, you are seeing this on a daily basis, aren't you?
Yes.
Yeah.
True. In fact, most of problems, healthcare problems,
yes.
In general, it is being affected not only in Seychelles, all over the world,
yeah.
By the lifestyle.
Yeah.
Yes. Now I think it is being one of the most important factors that affect most of the disease,
yeah.
the lifestyle, what we are carrying. So logically, as a nephrologist and as a medical director of a big institution which is dedicated to the kidney
yeah.
problems, nephrologists to whom who don't know what is nephrology, it is the science studying and treating the kidneys.
Yes.
So logically dedicating our time to the kidneys, logically we have to speak about lifestyle all over the world and
yeah.
especially in Seychelles because we have seen a big changes in the last few years all over the world in the
yes.
lifestyle, the physical inactivity,
yes.
type of food and other habits. Logically, it's one of the most important factors that can damage the kidney.
Now, I know a lot of people, the kidneys are so small.
Very small.
Very small.
Yes,
and we tend to take it for granted, don't we, doctor?
It's 10, 10 centimeter, yes.
Yeah.
It's
How important are our kidneys?
In fact, the kidney, as a nephrologist, I will say that the kidney is the most important organ.
You're going to get in trouble with the cardiologist.
No. In fact, when we study nephrology, when we
yes.
study medicine, we say that the heart is it's the easiest organ because it's just a pump.
Yes.
Only.
Oh no, now we're going to get trouble with the doctors.
No, but this is the truth. I mean,
okay.
It's very important. You
yes.
cannot live with the heart,
yes.
without the heart. The problem of the kidney is a very complex organ, a small organ. We have two organs, two
yes.
kidneys. It is present in our back, near to the spine,
yeah.
okay, from the back. But the function of the kidney, in each kidney there is 1 million units of filtration. And this unit of filtration, it is working 24 hours, not pulsed by any other organ.
Okay.
It is filtrating waste, toxic,
yeah.
salt, medication, any waste product of our food,
yeah.
and water. At the same time, the kidney, it is controlling our blood pressure, this is a very important fact that people think the heart is controlling the blood pressure. No, the kidney is the organ, the most influent organ in our blood pressure.
So if we're seeing something wrong with the blood pressure, then we have, that might be an indicator that something is wrong with the kidney.
Most probably.
Most probably, okay.
Okay, and then a part of this, the kidney has endocrinology function also. The production of erythropoietin, the production of angiotensin, which control the blood pressure.
Yeah.
So it is a complex organ and very important organ, and very easy. It can be affected by most of chronic disease like diabetes,
Okay.
hypertension, and other immunological or rheumatological disease can affect the kidney very easy. Why? Because it is full, all the blood from our body pass every day multiple times through the kidney. So
Okay.
any problem in the blood will go directly to the kidney.
So on a daily basis, you say 24/7, our kidneys are working.
For sure.
And a lot of people are like, but if it's working 24/7, then it's okay, we're functioning. What are some of the symptoms? What are some of the signs as an individual that I have to be on the lookout to say, oh, I'm going to remember Dr. Iyad now. Something is wrong with me. Something is not right. I have to go to the hospital and have a basic checkup.
This is the most dangerous things because kidney disease, when
Yes.
it starts, there is no symptom.
Oh,
Exactly.
it's a silent killer, isn't it?
Exactly.
Ooh.
Silent, usually it is silent disease.
Okay.
And start giving symptoms when around 80% or 85% of the kidney is lost, then you start have
But
symptoms.
doctor,
the big
when you're talking about 80%, that is very far off
Exactly.
into the problem of the
Exactly.
Is there any possibility of reversing these problems?
In a few cases, which is acute kidney injury, when there
Yeah.
is acute problem, yes, if it is treated at time,
Oh.
yes, we can revert the problem.
Okay.
But in chronic kidney disease, when the damages start being produced during years,
Yes.
most probably the kidney will be fibrosed, lost, and there is no recovery.
When you say fibrous, it turns into, like, say, rocky
Atrophic, yes,
hard.
small.
Okay, so I've got some people sending in questions already this morning. Merci pour votre question de 88 89 89 Issa Landois, que vous êtes capable texte nous et of course participe dans nos conversations aujourd'hui bon matin. Mon croyais pourtant pareil nous dit nous pouvons faire référence avec Ouroyon, mesdames et messieurs. On a des petits là voilà docteur dit au ployo la main ou a gagné une idée qui grossait ou that's one kidney, right?
Yes.
One kidney, on a deux, il l'a pas derrière. Et aujourd'hui, bon matin, nous devons faire face avec la réalité qui parfois, nos lifestyles, quoi qu'il nous mange, quoi qu'il nous boit, qui manière nous peut vivre, y influence nos bonnes conditions médicales. Mais par contre aussi, nous devons faire ressortir qui, si ou en a tension qui est un petit peu haut, ça est déjà une indication qui peut-être il y a un petit problème avec nos royaux. Now, how do we test to know? Are there other tests? What are some of the tests, basic basic tests that we can do that would indicate that there is something wrong with the kidney?
Very nice question, because the test of the kidney is very easy and very simple.
Okay.
Only the kidney function in blood. This is blood test.
Yes.
Kidney function, very easy. We
Yes.
can get the result very fast. And the urine test.
Okay.
A lot of people, they don't give importance to the urine test, but the urine give us a lot of information how the kidney is going. For example,
Yes.
some of kidney disease can be reflected in by the presence of red blood cells, which is small blood, non-visible blood
Yes.
cells in the urine, or the presence of protein or albumin in urine. This is the first sign of starting the kidney problem.
Yeah.
And it is silent. Without the urine test, you cannot even detect this problem. But this is what we use as a screening to detect early detection for kidney disease.
And surely you've been in Seychelles for so long. Mr. Kuldeep, I'll come back. I'll come to you. Sorry
No
about
worries.
that. Just to you've been here for how long now?
Now for 3 days, I'm
Oh, you're
I'm
For
working
3
in
days.
Dubai. Yes.
But you've already started seeing some patients, haven't you?
Yes, I
What
was
are-
here
yeah.
last year also.
Based on your previous visit and this visit the same, what are the common similarities that you are seeing in some of the patients here in Seychelles?
Yes, when we speak about kidney, we have to focus in the first cause of kidney disease all
Okay.
over the world.
Yes.
And which is also frequent in Seychelles also.
Yes.
Diabetes.
Okay.
Diabetes. This is the first all over the world. This is the most common cause of kidney disease all
Yes.
over the world. not only kidney disease, heart disease, and even blindness in the world. This is the first cause, diabetes.
Yeah.
And it is also silent disease because diabetes, you don't feel pain when you have diabetes. The blood sugar is very high, and at the same time it is destroying all the vessels, kidney, heart, other the organs.
It's
and
a vicious cycle, literally.
Yeah, exactly. And unfortunately, if I don't remember bad, in 2021,
Yes.
in Seychelles, I think there was around 10% of the population with diabetes or pre-diabetes, and this is high percentage.
For a
so
small
this is-
population, isn't it?
Exactly.
Yeah.
10% is a high percentage, and we know that bad managed and bad treated diabetes 100% lead to cardiac problem, kidney problems, and other type of problems.
And a lot of the time somebody says, okay, so we have two kidneys. If I lose one, can I live a normal life with just one kidney, doctor?
We can live with one kidney
Yes.
without any problem.
Okay.
You can live 100 years without one kidney, but without having any disease that affect the kidney. And when we have systemic disease like diabetes and hypertension, usually this disease affect and attack both kidneys together.
Okay.
And this is the problem.
So the probability is that both of them are affected.
Exactly.
Okay, we talked about the situation in Seychelles. We've talked about some of the patients that are walking in. What are the demographics, the age groups?
Usually, this is a very
Elderlies, young people.
usually when I have studied medicine
Yes.
in 1997, we were speaking about diabetes type 2, especially type 2 diabetes, like a disease that come after 50 years, when you have 50 years, 5 years. In the last few years, we are seeing a lot of people with 25 years, 30 years with diabetes. And this is this is scary, in fact, because when you start a very dangerous disease very early, 30 years earlier than before, that means you are losing 30 years of life quality and 30 years more mortality for this disease, because this is the most dangerous disease actually. And in the last year when we were here speaking about in the World Kidney Day, it is very scary because diabetes all over the world will be expected in 2030. I think maybe 30% more than 10 years ago, and this is very high percentage.
And it's worrying figures, isn't it? All right. Now, Mr. Kuldeep, I'm coming to you now. Amsa, you are literally the only healthcare facility that is situated within the Ministry of Health. How has that been? And you guys have been here for quite a while now. How many years have you been here for?
This is 10th year is going on. 9 year has been already completed by Amsa.
Yes.
And we came here in 2015 in association with the Ministry of Health. And the purpose of coming to Seychelles was to running the dialysis unit, because earlier the mortality rate was very high. And by bringing Amsa by Ministry of Health, the mortality rate has come down to nearly zero.
Okay.
And the quality of dialysis we are providing, the people are Seychelles are taking dialysis years and years, and the best quality service we can provide. Our standards are European standards.
Okay, but just to let us know, how many dialysis machines you've got in the unit right now, and on a daily basis, how many patients are you servicing on a daily basis?
Currently, when we came in 2015,
Yes.
there were 96 patients.
Okay.
And as of now, today, 211 patients in Mahe. You can see the growth.
The figures,
In 10 years, it's really scary figures if I compare with the world census.
Okay.
And we are having 50 machines, dialysis machines in Mahe.
50?
Yeah. 50. And 3 machines in Prale.
Okay. So you've expanded now. You've gone to Prale.
Yeah, Prale
Okay.
and Mahe. With God grace and wishes, we may go to Ladik also. So we can provide services at your convenience and easy.
Okay. And of course, we know that you guys have been running the service, as you said, for the past 10 years. What are some of the timings? Because previously we had people until like 1 o'clock in the morning doing dialysis. Now, obviously with this, there are definitely some changes. What are some of the changes that Amsa has brought in to the dialysis unit?
Yes, you have rightly asked. We start our first dialysis morning 5 a.m. and my support staff, which comes by 3:30 a.m.
Okay.
so that the dialysis will start 5 a.m.
Okay.
on time.
What is the necessity for the clients to come at 3:30 when the service starts?
No,
at
no,
5?
my back office staff comes.
Oh,
They
okay,
prepare the
sorry.
machines,
Okay.
beds, so that
Yes,
once the
alright.
patients are ready, so they can go directly on the machines,
Prepping for the day's work.
preparing for the days.
Alright.
And we are running 3 shifts in a day, and generally our clinic closes by 9, 10.
Okay.
Yeah.
So the last person goes home. at
Yeah,
10.
home.
All right. And you open on weekends as well, Mr. Kuldeep?
We are only Sunday off,
Yes.
otherwise 7 days a week. And our staff is always on the call.
On call.
If any problem, my staff will be always there.
Now, just to ask a follow-up question from that, now you have your patients that is under your unit. Of course, they see their specific doctors within the unit itself. Now, what happens if one of your patients suddenly falls ill and comes to the casualty? Do casualty refer these patients directly to Amsa, or they are treated at the casualty and then referred to Amsa?
First, they are treated at the casualty
Okay.
because AMSA only does the dialysis services and renal
Alright.
care. If there is any related to renal problem,
Okay.
then AMSA doctor will be there in casualty also if it is required.
Okay. All right. Now I'm thinking of the medical history for the patients. How did at one point or another, there has to be that collaboration.
Yeah.
Whereby the doctors within the casualty, the ER, knows a little bit about the history of the patients just to facilitate the work, because sometimes, as we say,
Yeah.
time is between life and death,
Yes.
you know, and the quick decisions can make a difference in a patient's life.
HC and AMSA work very synchronized way.
Yeah.
So there is no gap between the
Okay.
communication or anything.
All right.
Yeah.
All right. Mesdames et messieurs, par nous dit aujourd'hui bon matin nous faisons conversation avec Amsa, l'organisation qui gagne sa mandat pour travail avec le ministère de la Santé pour donner service dialyse ben patient ici Cécile, et of course ou capable de faire par nos conversations aujourd'hui de bon matin dès 88 89 89 mon connaît il dit c'est maé il y en a 50 machines l'opérale il y en a 3 et probablement dans les futurs, définitivement, la DIG aussi a gagné son facilité dialyse. Now, Dr. Yad, when you come to the Seychelles, obviously, you see the patients on Mahe. I know they're going to come and ask me this, but do you get the time to go to Prague as well, just to see the patients and see how they are?
Well, in fact, I'm not seeing all patients in Mahe usually.
Okay.
I'm working actually in Dubai.
Okay.
When we come here to visit, our target in AMSA is to organize a program prevention.
Okay.
Prevention. Our target education for our staff, bringing the last update in nephrology and techniques and everything training. In fact, today I have training with our staff here.
Okay.
And our idea now is to go for prevention, because seeing the number, how it is increasing, our worry is what will happen with our kids after 20 years, for example.
Yeah.
So our target now is to go to reduce these number, which is increasing very fast.
Okay.
You know, so this is the target of my visit this time. We are logically in Dubai and here, and we are connected, Amsa Dubai and Amsa Seychelles, to provide the last update and last new techniques, new medication, new everything. I mean, update. We have to keep the standard and the best.
How many Seychelles staff do you have on board of your team, Dr. Mr. Philip?
We are having around 100 staff which are supporting to AMSA facility
Yes.
services. So doctors, technicians, nurses, healthcare assistant, around 100 staff are working for the AMSA.
And out of the 100, how many are Seychelles?
Seychelles is around 15 to 17.
15. Are you expecting to grow the numbers, Doctor?
Definitely yes.
Mr. Kuldeep, sorry about that.
No.
You're expecting to grow the numbers?
Yeah, definitely yes. Why
Yes?
not? Yeah.
In terms of, yeah?
Because unless until their support, how can we grow? They are the connector between patients and us.
Okay.
Yeah.
All right. We'll take your word on that one when we catch you on an interview in the next time. Of course, as I like how you said, Dr. Iyad, prevention is a big step to preventing anything from happening in the near future, fixing the lifestyle of our people and making sure that they understand that it is their responsibility as well to a certain extent for them to take care of themselves. Now, I know you've said you come in, you train your staff, you explain to them, giving them the latest updates on what is going on in the world, in your specific field. What is the relations between the nutrition services of the Ministry of Health locally, so that before these people even, the patients even come to the dialysis unit, or try and avoid them coming to the dialysis unit, what are the collaborations between your Amsa and the ministry in terms of your prevention program?
This is what our next step going. I think when we speak about prevention, we have to work in different points, starting from the education, even since schools, because sometimes what we can call, allow me to say, bad habits, it can start from, it is culture.
Yes.
Culture. So we have to start
and
working.
we love our fatty food.
Everywhere now,
Yes.
everywhere. And because a lot of changes in our life, everything is more faster. We say that we don't have time. In fact, we have time, but we cannot see the time.
Everything that we eat that tastes so good in the mouth is probably
exactly
the worst ones, isn't it?
a lot of processed food, a lot of sugar. This is I think one of the most dangerous things that we're. So the physical inactivity, because the tendency each time to do less exercise, move less, and we have to start working from even kids.
Yes.
Start in the childhood.
Okay.
Working in the education, because what we are doing now, maybe we'll see the result after 25 years, 30 years, and so our target is to start making changes in the lifestyle, food habits, more awareness about what is really good for health and what is really bad.
Are you going to reach out to the schools? Is there now you're crossing boundaries. You're going to with the Ministry of Education.
Yeah.
Now, seeming that this is already in existence through the Ministry of Health, that's why I'm asking you how's the collaboration between. Sometimes you hear there's a budget constraint, but perhaps your organization supporting the ministry, complementing their programs. Are you planning to go into the schools to talk to the children, or even test on the children, which is part and parcel of the tests that are being already done with some of the schools?
Exactly. Nephrologists, we think different than other doctors. Other doctors, they want to treat. In nephrology, unfortunately, I can say, I don't know exactly, but maybe 15% or 20% of kidney disease are treatable. So in the other 80%, we have to go for prevention. So logically, if as a nephrology institution, Amsa, as a nephrology company, if we don't work on prevention, logically there will not be success in our program. So our program is based now to prevent the kidney disease. And logically, going on proposal for example, Ministry of Education to start working with schools, professors, schools, offices, any other institution, private companies, public companies, to give enough awareness about kidney disease. And I think this is the first step to make at least doing something for our, maybe the impact will not see the burden in the actual population, but maybe in the next generation we will see that result.
Mr. Kuldip, I have somebody who's come in and asked, do you provide private services for organizations that wish to bring Amsa into their organization for tests on their staff, and as Dr. Iyad has said, training, or maybe just a talk about lifestyle, about the different impacts of renal problem on their lives? Is that a possibility that Amsa is exploring, or is this possible?
No, it is possible, because Amsa is Amsa Renal Care, which is associated with the Ministry of Health in Victoria Hospital. But other than that, Amsa Medical Center is also there at Hassan Ali House, and we are providing the private services to the people of Seychelles. So in Amsa Renal Care only focus on the dialysis, whereas the Amsa Medical Center, other services like gynec, pediatrics, GP, etc.
So you've expanded your services.
We have expanded.
So you can go out of your clinic to the private facilities.
So we can provide the services to the private companies, schools, and offices. Even we can provide the home services also, where the patient is critically ill. Our doctor goes to the home.
Door to door? All right. Do you do mobile dialysis services? Dr. Iyad is shaking.
Here, no, not yet. Not yet,
but it is a possibility, isn't it?
In Dubai, we are doing.
Yes, in the comfort of their own home.
Yes.
I mean, especially when you have patients perhaps who are paralyzed,
Exactly.
special
Old age,
needs.
yeah.
Are we considering that for Seychelles?
We hope
Definitely
that
we'll-
in the
Nicole is like,
future,
oh no,
in the
she's
future.
No.
stirring problems there.
No. Definitely we will. For the people of Seychelles, we can go one step further
Yes.
for providing the better quality of services to anywhere.
Okay. Mesdames et messieurs, aujourd'hui bon matin, dès 88, 89, 89. I do go back to La Digue. I do have somebody commenting and said that the center has been open for a year and it has been on the master plan to have a dialysis unit. When do we expect? Because I think the patients have to come down to Mahe for that. How far off is it, Dr. Kildup? Give them hope.
Yeah, we are in discussion with the Ministry of Health, and very soon we will come with the final plan, and
Is it
very
before
soon
the-
it will be
before
open.
the end of the year?
Before we are trying our best, and definitely it will be very soon.
Very soon.
We are working on ASAP basis. You
We
can say.
are yes, we are working on ESCP business. Oh, Oliver, faut espérer ça répondre aux questions aujourd'hui bon matin. So the faster these decisions gets taken, and of course, the faster the services gets to the patients. So chop by nous dit. Answer the emails, get the talks going. Rolly bonjour, aujourd'hui bon matin. We've got one question from one of our viewers. Good day to all. Is there an age limit as to when dialysis can be ideally performed satisfactorily, or it's limitless? Thanks and have a jolly good day. Dr.
If there is any ideal age too?
Is there an age limit
Yes.
as to when dialysis can be ideally performed satisfactorily, or is it limitless?
No, there is no limit for
Okay.
dialysis. And I had this question yesterday. I had another meeting for open meeting in TikTok for
Yes.
people who raise question, and they ask the same question.
Okay.
How many years can people live in dialysis? They can
Yes.
live 20, 30, 40 years if their condition, I mean, if they are receiving proper dialysis,
Yes.
high quality dialysis,
Yes.
they can live all the life,
Yes.
which is corresponding to the patient.
Now,
I mean,
I know when we say that dialysis is one of the services that is being done, and of course, patients have to honor their dialysis.
Of course.
How often does a patient do dialysis? Is it specific per person, or how does that go, Dr.
dialysis
Iyad?
is a replacement of a lost organ,
Okay,
kidney.
yes.
So you lose this organ for thanks to God,
Yeah.
we have the science, we have the knowledge to compensate the loss of this organ. So if you are receiving the proper treatment
Yes.
properly, because a lot of patients, for example, they are not receiving proper dialysis. For example, in Dubai, a lot of patients, they are not, it is 3 sessions per week, 4 hours each session, and they are skipping 1 session every week. So logically, the quality of dialysis is not the
Yes.
same. If you are receiving proper dialysis, I had patients in Spain, for example, 30 years on dialysis. Now, our target as a nephrologist, and also in Amsa, for example, we are collaborating with 3 big hospitals in Dubai in kidney transplantation. Why? Because it is different. You are providing not only survival for the patient,
Yeah.
we need to provide also life quality. The life quality for a transplanted patient,
Yeah.
it's better than dialysis because they are not dependent on machine. But logically, if there is no kidney transplant, we have to go through dialysis. And people can live even 20, 30 years if they don't have any other cause
Yeah.
for mortality, like cardiac problems or any other thing. Logically, for our patients and all over the world, now we are trying to work from all the nephrology associations work to promote more the transplantation.
Yeah.
Because logically, the quality of life, and even if we compare the survival in transplanted patient,
Yeah.
better than survival in dialysis.
And of course, after the transplant, there is there is the aftercare that comes
course,
with
very
it.
important.
Does the aftercare consist of more care? I would say more details rather than somebody who's just simply going on dialysis.
No, I think it is the care must be similar.
Okay.
I mean, the patient, it is on dialysis, the care depends on the facility, on the doctors.
Yes.
The care after transplantation will depend on the patient because they have to receive life and medication, immunosuppressant medication to
Okay.
keep the transplant
Yes.
safe, morning and evening. It
Yes.
is twice. Unfortunately, some patients,
But doesn't that create another problem? Because
No,
once you're taking in the medication on a daily basis, doesn't that affect the kidney?
In fact, the medication that preserves the kidney, the transplanted
Yeah.
kidney, long term, it is harmful for the kidney.
It is
the same
harmful,
way,
yeah.
Yes, exactly, but it is different because if you don't take it, you will lose the kidney maybe in 1
Yes.
month.
Okay.
If you take it, you will lose it after 20 years or 30 years.
Okay.
So logically, making balance. In medicine, everything is balance.
Yeah.
Benefit or risk.
Yeah.
So if the risk is more than the benefit, we don't
Yeah.
give the treatment. If the benefit is more than the risk, we give the treatment.
All right, one question that came in. Private services for dialysis for visitors coming to the Seychelles, Mr. Kuldeep?
Yeah, we provide tourist patient all the
Okay.
dialysis services inside the Victoria Hospital
Okay.
in association with the Ministry of Health.
Mhm.
And there are people who are coming to Seychelles,
Yes.
dialysis patient, and they stay here for 15 days, 20 days. Even we provide tourist patient in Prague also.
Okay, so that's a plus for tourism, isn't
yeah,
it?
yeah, yeah.
Medical tourism, voilà, mesdames et messieurs, c'est une
Yes.
famille qui en vivent une vacances. S'il y a aucun bon client qui demandait s'il y en a service dialyse pendant son séjour ici, Cécile, oui, il y en a. Amsa et sa clinique qui est capable de donner sa service, ça veut dire qu'il n'est pas restricté pour les vacances ici, Cécile.
Even
Yes.
AMSA is also trying. As a AMSA, we are going to many countries now, and we are publicizing. Come to the Seychelles.
Yes.
Even you are the dialysis patient, come to
Yeah.
the Seychelles. Your services will be as equality standard as per the Europe standard.
Because that's a relief, isn't it? When somebody is sick and they want to travel the world, but
Yeah.
not limiting somebody from traveling because of their medical
Yes.
conditions. Now, Dr. Yad, shunts for the kidney, for the dialysis patients, is it done by the Amsa or is it done by the government of Seychelles, by the Ministry of Health?
Here, I don't exactly know, but it is, I think, collaboration.
The shunts,
Yeah,
For
but
the patients?
done by the AMSA.
they're done by the Amsa.
Yes.
So, all right. Mesdames et messieurs, la voilà, pour espérer répondre aux questions. We've got a few more questions coming in this morning. 1 second. On peut s'attendre à ce qu'ils soient sortis pour matin. Là, nous demandons beaucoup de questions. But I've got, oh, okay. I think Dr. Yad, this one is for you. We've got one gentleman asking, how worried should he be if the urine is smelling very strong, a strong odor of ammonia? This is face is enough to tell.
But with normal kidney function or not, I mean, this is very important. A lot of people, when they see the urine, it's
Yes.
very strong,
Yes.
they think that there is a problem. Urine must be strong.
Strong
I mean,
odor?
Yeah, of course. I would be worried if I see the urine like water. That means
But
the
actually,
kidney is
that's
not
the-
clearing.
But doctor, see, funnily enough, that is the concept we grew up with. Because your parents would tell you, drink water until your urine is the same color as the
Exactly.
water.
If you drink, for example, 3 liters of water
Yes.
or 4 liters of water, logically the urine will be diluted.
Yes.
But if you drink normally and you see that the urine is very diluted, this is, I mean, you have to be worried.
What is normal?
Normal that the urine a clear yellow.
What is
This is
normal,
the normal.
in terms of quantity of water that we should be drinking on a
exactly.
daily
It depends
basis?
on the situation. Logically, a patient or a person who's living in Dubai
Yes.
needs more water than who's living in Spain, for example,
Okay.
because there is what we call insensitive loss. You are losing water through the skin,
Mm-hmm.
through the breathing, and logically under AC, you lose if you work under the sunlight outside under the high temperature, you
Yes.
lose more water. So between 2.5 liters of water to 3.5 liters is needed for to keep our kidney healthy, to avoid kidney lithiasis, kidney stones, and more. I mean, to keep the kidney healthy. Okay. If you see the urine with a lot of smell and dark or anything, first of all, you have to rule out infection, urine infection. This is the first cause of changing in the urine color.
Okay.
And small test of urine, which can be you can get the
Again,
result
we
in
refer
15
back to
days.
it, isn't it? Yeah.
I mean, 15 minutes, you
Yeah.
can get the result, can give us a lot of information. If there is infection, if there is proteinuria, if there is gravels or any other thing. So
First
I
urine in
would
the
like
morning.
to go. First urine of the morning is
yes.
the best indicator of kidney.
So if he's saying the first urine in the morning is of strong odor and of dark color.
That means maybe you are not drinking properly. You have to check if you have foamy urine
Okay.
This is one of the indicators, the presence of proteinuria. If it is a very foamy urine, because small foam, can be normal, especially in men when they are not drinking enough water. It's very concentrated. But if you see your urine foamy, go to the family medicine doctor to do urine test, or to the nephrologist to do urine test.
Mais par contre, nous pouvons dire, pas espérer pour l'urine, I mean, on a yearly basis, somebody should be having a medical checkup. How often should we, without having any issues or without knowing we have any issues, how often should a patient, somebody go to the hospital for a checkup?
Exactly. I think not for the hospital, primary care. We
Primary
have
care,
to
yes,
encourage a primary care communication between family medicine and general practitioner, doctors and the people in general. This is the first step and the most effective step. If you are healthy without any chronic disease, diabetes, rheumatoid problem, hypertension, I think after 45 years, at least once yearly, you have to do a simple checkup yearly. For people who has chronic disease, independently of the age, they have to do between 6 months to yearly checkup. For example, a diabetic patient, for example, they have to check kidney function yearly. They have to check their eyes yearly. They have to go to the cardiologist. So it must, because this is the, if you detect this problem when they start, when the problem starts, you can avoid a lot of complication. For example, and very, very easy example, diabetic patient with retinian problem, if they treat it with laser or with injection early, they can keep their vision. They can still, they will not lose the vision. At least for 20, 30 years more, they can keep their vision. And this is the small example, but more palpable. You know, because kidney, there is no pain, but vision, yes, you notice when you start losing the vision.
You definitely start seeing things not clearly. All right, mesdames et messieurs, pareil, docteur Indy, il est pourtant, pour dire, pendant 45 ans, at least, une fois par l'année, mais c'est moi, si vous avez un patient qui a un bon problème chronique, il encourage at least tous les 6 mois, mais par contre, vous supposez déjà faire un bon test à travers un spécialiste qui peut gagner un traitement. Et si tout bon patient qui en a diabète, lisier, l'équerre et rognon est fondamentalement important pour gagner ticket. Now, Mr. Kildip, I've got somebody asking, and the person is a hotel owner. What are some of the costings for a dialysis, per dialysis for visitors in the Seychelles?
$350 we charge for all the patients who are coming from outside the country.
That is all inclusive.
All inclusive.
All right, mesdames et messieurs, Agnès, faut espérer ça y répondre aux questions. $350 par patient et all inclusive. Mais par contre, si vous avez envie, mon président est capable de call côté Amsa. Et je t'avais donné beaucoup plus l'information. Of course, they can call you and call the clinic and ask for more information. Loads of website. I'm assuming on your website as well. You've got all the information?
Yeah. It's provided all the information.
All the information is there. Là, voilà, mesdames et messieurs, pour bon monde qui a un guest house, et un hôtel, ça est une option. Si au patient, si au client, excusez, peut demander, Amsa yo fait service dialyse pour un patient qui fait que, même si on a une condition médicale, ou capable de venir, Cécile, venir faire une visite ici, $350, et all inclusive, ils sont prix qui peut donner sa bonne patient. Alors, the patients are very anxious, very impatient, Mr. Kildip. They've been asking for the dialysis unit on La Digue. I can imagine with the monsoons, it's very difficult for them to travel. What are some of the side effects of dialysis? I know with everything that we do, with every treatment that you do, there are some people that get certain side effects after the treatment. What are some of the side effects of the dialysis process? I mean, 4 hours on a machine. I mean,
yeah, of course.
That must be
dialysis
hard for the patients.
Exactly. Dialysis is not like having kidneys.
Yes.
I mean, this is not the same quality. Kidney quality is better. This is why we call people to save their kidneys. Logically, there is some people can have complication during dialysis or even after dialysis, depending on their heart condition or other condition. Usually, nothing happens. I mean, it is we don't call side effects. Maybe some complication related to other diseases like cardiac diseases. especially patient who's having a lot of weight gain or are not following proper diet
Yes.
for dialysis, because logically, even if a patient is receiving dialysis, also he has to keep some special diet, some special medication, and
Yes.
some special. Usually, most of the complications of dialysis are being treated even during dialysis. Usually, we don't let any patient leave if he's not properly stable and with good condition.
Can a dialysis patient go to work right after a
Of
dialysis
course,
session?
of course.
Would they be feeling perfectly all right, or would there be like tiredness, weakness? No.
Yeah, of course. We have patients. I don't know exactly what if all patients here are working, but in Dubai we have a patient who's living in Dubai, in Spain, in France,
Yes.
where I worked. We have patients who finish dialysis and go directly to work.
So they can try and live a normal
Yeah,
life.
of course, of course. We encourage patients to make normal life.
Yes.
Dialysis is not a punishment; it is a treatment.
Okay.
A lot of patients, when we tell them to start dialysis, we are deciding to start dialysis because the kidney is failing. If you pass a lot of time with high toxic level like urea, urea level, can produce oxidation for your tissue. So it is damaging your tissue slowly.
It can poison you, doesn't
yeah,
it?
Of course,
Yeah.
of course. And a lot of patients, when they start dialysis, they say, "No, I'm really better. How I was living before with." But usually, it is small effect coming gradually.
Yeah.
The patient cannot feel like pain, and it's like will become like familiar with the situation.
Okay.
So he will not feel the big difference when he start the kidney failure.
Yeah.
But then suddenly, when you clear his body from toxic, he will suddenly feel more active, more normal, more
Yeah.
coming to the normal life. So logically, we tell patients, yes, try to do exercise, even being on dialysis.
Yes.
Normal life, even being on dialysis.
Can they do you encourage them to exercise as well?
Of course.
Because with the shunt and everything, there are some precautions they have to take. But can they?
Exactly.
You encourage them to
Yeah,
exercise.
of course. They must. It will improve their life quality.
Okay.
Muscle atrophy will improve with exercise. Logically, if they have a big issue with the heart, I
Yes.
cannot tell them go to run for 1 hour.
Yes.
But logically, within the limit, what is allowed for them, they have to do exercise. Will improve the circulation, muscle, and bone health.
Has there been instances where kidneys failing, dialysis is implemented, and the patient does not have to continue on dialysis after?
Yeah, of course. In acute kidney failure,
Yeah.
when patient around 10% of patients who's having acute kidney failure remain on dialysis. Other 90%, depending on which hospital and which country, most of patients, if you treat the patient, they can receive dialysis for 1 month, even 2 months, some people, and then the kidney, with the proper treatment for the cause of the kidney failure, they can recover the kidney function. Proper follow-up from the nephrologist, they can recover the kidney function, even if it is not completely recovered, at least partially, to stop dialysis.
Yeah.
Yes, we usually stop dialysis for some patients every year.
That's good news. All right, Dr. Kuldeep, Mr. Kuldeep, sorry. Before we wrap things up, I'll give you the possibility to say a few words to the people of Seychelles listening in this morning.
See, last 1 decade, Amsa is serving people of the Seychelles, and we would like to continue serving the people. And the best quality and care we want to bring to Seychelles. We are going all over the world, and whatever see the best, we bring to the Seychelles, so that our people of the Seychelles can take the best dialysis services and the medical services what we are providing.
And the people of Ladig will be seeing you soon.
Prali and Ladik, we are saying
Raleigh is done, but Ladig will be seeing you soon.
it's very soon.
Very soon. We'll
Yes.
take your word for that. The patients are desperately looking forward to that. Dr. Iyad, final word we give you this morning for the
Yes,
Seychelles.
our message from
Seychelles
Amsa.
people?
Yes, our message from Amsa is for everybody. People with chronic disease, people without chronic disease, love your kidneys. Try to think about kidneys. Remember that you have kidneys. As you remember that you have other organs, remember that you have kidneys, because kidney problem has a big impact, big burden in your life. So normal diet, healthy diet, more exercise, treating disease at time, diabetes especially,
Yes.
and hypertension. This is the most 2 leading cause of kidney disease, and education of kids. Education of kids.
I missed out a question. Sorry about that, Doctor. sometimes in Seychelles we have patients, high blood pressure patients, changing medications, brands. Can that affect
the blood pressure before we was the medical community or physician community were treating the patient with take the medication, you have hypertension, and the patient disappear for 3-4 years without coming to the doctor, taking the same medication.
Okay.
This is dangerous.
Yes.
A lot of people, when they start their hypertension, they have to follow up. And now the new guidelines speaking about hypertension, the patient must check the blood pressure at home in
Okay.
special condition. For example, early morning one time, evening another time.
And
Check the
that's
blood pressure.
before breakfast?
Before breakfast,
Okay.
after going to the washroom.
Okay.
It's very important. Sitting normally
Yes.
without crossing the legs and everything
Yes.
for 15-20 minutes without doing anything,
Okay.
and then check the blood pressure, putting the arm at the same level of the heart
Yes.
over something, one pillow or something,
Yes.
and check your blood pressure and register your blood pressure and take it to your doctor, family doctor, to see, because some patients, when they start taking the medication, the blood pressure after maybe 6 months, 7 months, the blood pressure became normal, and you have to reduce the medication.
It's regulated, isn't it?
Exactly, regulated, and you have to reduce the medication or even stop medication.
Okay.
Every year in the OPD consultation, we stop medication for a lot of patients,
Yeah.
and sometimes we have to increase the medication, and other time we have to give accurate medication for the patient.
Yeah.
Maybe this medication is not good because it can be interacting with other medication for
Yeah.
other disease. So we choose. We have more than 60 medication for
Yeah.
blood pressure. So logically, we have to make it proper for each patient, other disease, and maybe we can stop the medication for blood pressure. If this hypertension became because of stress situation
Yeah.
in this month, and very important, before giving any medication for blood pressure, the first 2 months or 1 month, lifestyle changing, and then evaluate the patient again.
Okay.
And very important, checking the blood pressure at home, because a lot of people has what we call white coat syndrome.
What
When
is
they
that?
go to the hospital, they have high blood pressure.
They're
They
scared.
go exactly, even if they don't feel it, because they say no, I don't feel
Yeah.
anxious, or I don't feel. Even if they don't feel it, they go to the hospital, suddenly blood pressure is 160.
Yeah.
They go home 120
So it's better if the patient knows how to take their blood pressure at home.
home.
Do it before before breakfast, after the first pee
And
in the
before
morning,
going to bed.
and before going to bed.
Yes.
And encourage them to bring that information
The doctor.
to the doctor when they go for their
Yes.
visits.
Very important.
Very important. Dr. Iyad, was an absolute pleasure. Thank you for
Thank
coming
you.
this morning. All the best during your trip here in the Seychelles. And
Thank
of
you very
course, Mr. Kildip, I know we're going to be coming, we'll be seeing each other very soon.
Yeah.
All the best for you and your team and
Thank
the
you so
group
much.
as well. And thank you for coming in this morning. Et mesdames et messieurs, faut espérer ou qui dans la cour, on gagne maximum l'information, nous la santé et nos priorités et aussi nos responsabilités. Et fait si qui ou lifestyle, il pape en dommage ou la santé qui fait qui réduit la quantité de temps qui nous en a pour passer avec nous la famille et les amis. Et si vous avez envie et raison pour imaginer l'eau à cause que vous devrez arranger le lifestyle, regardez autour aux enfants, aux madame, aux messieurs, aux familles qui autour. Est-ce qu'ils savent pas raison assez pour prendre une décision clé et importante le côté ou lifestyle que vous pouvez vivre avec aujourd'hui. Mesdames et messieurs, ça c'était une Topik Conversation pour aujourd'hui bon matin.